Thank you, Dr. Romana. Assalamualaikum and good morning. My name is Salleh and I'm one of the faculty members who are trained through the MIS program. And I've spent a couple of months in Yale back in 2022. And I'd like to take this opportunity to thank Professor Vic Altis and Professor Adiba Karuzaman for this opportunity, not just the learning opportunity that I've gained over the years, but also the opportunity to transfer some of the skills and knowledge to the colleagues here in Malaysia. For today's presentation, I'll be presenting on implementation strategies for sustainability in clinical and community settings, what works and what does not work. I'm going to start by first describing some examples of implementation strategies in clinical and community settings beyond HIV, considering the diversity in this room so that we are able to envision and make connection to the concepts within implementation science. Within clinical settings, for instance, we have the promotion of hand hygiene practices among hospital nurses, employing multimodal strategies including staff education, regular feedback, and making changes to the physical environment, as well as by having more hand sanitizers more accessible, which increase compliance and reduce healthcare associated infections. There's also mental health screening within primary care settings that apply facilitation strategies that are task-focused and holistic in a way that it builds capacity for future implementation efforts. And the third example draws on implementation strategies from COVID-19 vaccination programs that kind of seek ways to address vaccine hesitancy among undeserved communities, including co-creation of strategies with community advisory boards, the use of mobile health or mHealth technologies, and also care coordination. Meanwhile, in community settings, there's the example of the cure violence programs that aim to promote the use of evidence-based methods for violence interrupters. So strategies that were applied through the cure violence program include the training of violence to mediate conflicts, community mobilization to support community cohesion, and also partnering with local law enforcement and community organizations in designing these specific activities. The Community Set Cares is a community-based prevention system that was designed to reduce drug use among youth using evidence-based preventive measures. And the strategy applied is to engage community stakeholders to form this coalition that kind of represents various sectors of the community. It includes schools, law enforcement, health services, and even parents and youths themselves. In the field of HIV, there are emerging discussions about the scale-up of PrEP in community settings, such as community pharmacies, and you'll hear about this later in one of the lightning sessions. Strategies include to engage local communities through targeted education efforts, provide training to healthcare providers, and also community-based organizations on PrEP delivery and management. And taking these two settings together, there could be overlapping of clinical and community settings which foster the integration of evidence-based interventions across a more diverse environment, which would enhance the research and impact of health initiatives. I'd like to take us back to the implementation science framework, particularly the EPIS framework, to remind ourselves of the sustainment phase that allows the program to be embedded within a provider or organization as a standard practice. And this phase can only take place after exploration, preparation, and implementation. But oftentimes we struggle to work around sustainability in maintaining long-term support for continued success of the intervention. But sustainability, beyond being a phase in the implementation process, is also a crucial outcome in its own right, and this is defined as the extent to which an intervention can be maintained, routine, or institutionalized by a provider or even facility. And we'll talk more about sustainability outcomes in a minute. Before that, we want to have a quick overview on the extent to which sustainability approaches have been applied in clinical and community settings. While it is good to see that over the years we're seeing an increase in the use of sustainability approaches in peer-reviewed studies, only 21% of studies reported any information on sustainability outcomes. And we're looking at comparison in the second graph on the right side of the slide. If you're looking at comparison across different settings, more than half were based in primary care settings. And a fewer approach were applied within tertiary care, secondary care, and even community healthcare initiatives. So what we're seeing is that sustainability approaches are often reported more in primary care settings, perhaps due to the structured environment, more focused on long-term interventions and even better data collection system. And also they benefit from a greater resource allocation, including funding. In contrast, lack of community involvement can contribute to fewer reports on sustainability approaches in community settings. So that's why we're seeing less and less approaches being reported within studies that looked at community-based settings. And without having active engagement from community members, it's really challenging to adapt and implement effective sustainability strategies, leading to less documentation, less monitoring, less evaluation on these strategies. So when there's this limited community engagement, there is a possibility for reduced ownership and commitment to maintain these interventions. And some of the key questions in sustainability approaches are, what exactly needs to be sustained? So there's a need to kind of identify what aspects of the intervention, such as the practices or the processes and outcomes that should continue over time. What would be the potential barriers to sustainability? We want to recognize the challenges or obstacles that kind of hinder the continued implementation or even the effectiveness of the intervention. And more importantly, how can we measure sustainability? And looking at what factors that would influence the long-term maintenance of the intervention. And this would include analyzing factors like organizational culture, funding, and also policy changes that would impact the sustainability of the intervention. Now that we have set the stage for the presentation, I would like to present the aims for today's presentation. The first goal is to look at how we want to conceptualize sustainability in implementation science, and then to describe effective and ineffective implementation strategies, and finally to explore different tools to measure sustainability. Now, I personally favor this definition of sustainability. So from this systematic review, researchers came up with this really comprehensive definition of sustainability, which is after a defined period of time, a program, clinical intervention, or implementation strategies continue to be delivered, and or individual behavior change is maintained, the program and individual behavior change may evolve or adapt while continuing to produce benefit for individuals or systems. And I think this definition is very specific, and it could mean two things. First one, sustainability as an outcome, which I will go through in a bit. And second, sustainability as an ongoing process, meaning that in recognizing the need to respond and kind of adapt to promote the continuation of improved practices, benefits, or outcomes. Now, these are the 6 sustainability outcomes defined by Shearer and Deering. So the first one being continued benefits for people, so meaning that when the program ends, it's important to keep track of whether or not the benefits for people are still continuing, like if health improvements can still be observed. And it would be this continuity of documentation of change behavioral or clinical outcomes among clients. The second outcome is to keep program activities going. It's useful to see if the original program activities or parts of the program are still happening, not just if the whole program continues. So researchers, if we're looking at from the point of view of researchers, we should check how many parts of the programs are still in use. But oftentimes it's being phrased as a dichotomy question. Did the program continue or not? Yes, no. But instead of doing that, we can be more explicit by looking at about the extent to which each component is continuing. For instance, the training processes are they still ongoing? The interagency collaborative effort that are being made part of the entire program, is this ongoing? And third one is maintaining community partnerships. So it's about looking at communities' readiness and capacity for interagency communication and also cooperation, and and collaboration. So this could be a valuable sustained outcome that could lead to a new set of activities or benefits for consumers. The fourth outcome that would be of interest is new organizational practices. So sustainability researchers would know that when an organization changes its practices, its procedures, and even its policies, it's showing how well the program has been integrated. And these are lasting changes. These are lasting changes in how the operation operates on valuable outcomes, even if the other parts of the programs do not continue. For example, if we're starting a no-smoking policy, it's a small win. It's a win itself, even though other changes that do not stick around, right? And fifth would be ongoing attention to issues. So once we start this program, we want to make sure that the motivation to start the program or to start the initiative is well sustained, meaning that these programs can keeping these issues in the spotlight, continue keeping these issues in the spotlight to help ensure that they get continuous attention and continuous resources needed over time. And the final one is the outcome in terms of replication in other places. So if a program is successful, or if the idea is successful, it can spread to new locations. So this is what we really want to see, whether a certain program can be scaled up in other locations. So it's good to see if other places are actually adopting and using these ideas, even if the original program at original site ends. So when we have staff disseminating these activities, this itself is an indirect proxy indicator for potential sustainability outcome, although such dissemination itself does not measure the actual extent of adoption by other communities. Now I'm going to look at effective implementation strategies for sustainability. What could be effective strategies? And these are strategies that are built upon stakeholder engagement, that prioritize capacity building, that finds its ways into existing systems, and that one that incorporates monitoring and evaluation. I'm going to go through one by one. So, stakeholder engagement. What is the rationale for having stakeholder engagement? So we want to build trust and buy-in because different stakeholders, they bring in diverse perspectives and local knowledge. And the second reason why stakeholder engagement is important is that we want to facilitate resource mobilization, because when we engage a wide variety of stakeholders, we can bring in ways to mobilize resources, including funding, personnel, and even materials, which are all critical for successful implementation. And increasing accountability, because when stakeholders are involved, they are more likely to hold each other accountable and ensure that the long-term sustainability of the initiative is maintained. Which is why community advisory boards are important. So community advisory board, or CAB, is a group of individuals often comprising community members, stakeholders and representatives from various organizations who provide guidance, feedback and support for long-lasting research projects or community initiatives. So part of what's important is prior to diving into implementation, we need to identify who are the right people we should be including in our community advisory board, our CAPs. Who are these people? What do they bring to the table? What perspectives, what unique perspectives do they bring to the table? And what are the skills and resources do they have to ensure that we can work together closely with them and making sure that this implementation is successful? Capacity building, I think we've heard this a lot, to training, to enhance skills and knowledge. So, especially when you're doing community-based interventions, so we want to provide ongoing training and education to our implementers to make sure that they have the necessary skills and knowledge, and so that they are informed of the protocols if you are making any changes to the protocols. So we need to keep them informed to implement and kind of sustain interventions. For example, one study has found found that continuous professional development for healthcare providers improve the implementation of evidence-based practice. So I think it's something that should be ongoing. Resource allocation and management, securing funding and resources is essential for building capacity. Having adequate financial resources allow us to invest in necessary infrastructure and tools that are required for a certain implementation strategy, which can significantly impact the success of implementation efforts. Effective management of resources, and this is a certain skill set on its own, and this needs to be incorporated within training in the first one, to enhance skills and knowledge. So this particular skill set on management resources can support aspects of intervention, especially working with community members, and having these skills among them would be really important as well. Strengthening organizational structures. We want to be able to strengthen organizational structures, especially in developing strong leadership to drive successful implementation through clear policies and procedures that help standardize practices and ensure consistency in implementation efforts. And this scoping review examines different ways of capacity building through education, dedicated implementation support roles, which you could have a look after this, strategic research practice partnerships and collaborations, co-designing knowledge, translation capability building programs, and many others that look at targeting individuals, team, organizations, or even system levels of impact. Integration into existing systems. So we want to make sure that whatever that we are proposing, whatever implementation strategies that we want to use is going to align with the larger organizational goals and structures. So it's reminding us to look at ways to design for these interventions to fit seamlessly into existing workflows to kind of minimize disruption and resistance. So what we can do is map current processes, and identifying points where the new practice can be integrated naturally. So this is important during the designing phase of the process of the implementation science process. And one of the tools that is a strong potential tool to do all this mapping is potentially using the flow charting, which I think you will hear more from one of the presenters for the lightning sessions. So we also want to look at ensuring policy and procedure compatibility. New practices should be compatible with existing policies and procedures. Even when they are not, we should include a plan for policy updates. And this would ensure that the intervention does not create conflicts or require extensive policy overhauls. And this particular study details the workflow changes required to implement routine screening for depression and anxiety in primary care clinics. It describes the development and implementation of an algorithm to guide healthcare providers in the screening process, including specific steps for patient assessment, documentation, and follow-up care. And it's highlighting how it is important to integrate these steps seamlessly into the existing workflow to kind of improve screening rates and patient outcomes. The final one would be continuous monitoring and evaluation. So continuous monitoring and evaluation, what it does is facilitates improvement, and it's driven often by real-time data to make sure that we have the right information at a particular time based on the latest evidence and based on the latest patient needs. And what we're doing through this continuous monitoring and evaluation is that we want to promote adaptive program designs that emphasizes on flexibility and responsiveness to changing conditions, feedback and emerging evidence. And finally, the use of this continuous monitoring and evaluation, it promotes scalability and replication. So it helps us to identify factors that contribute to successful scaling up and replication so that these effective interventions can be adapted and implemented in new settings. Now, for this section, I'm going to talk about ineffective implementation strategies for sustainability. As I prepare for component, I realized that there are not much studies that describes the things that did not work explicitly. Maybe because people don't want to say it out loud that the things that they have planned have failed. But there are actually calls for positive attitudes toward failure, reframing errors as positive learning opportunities and implementing ways to manage and proactively learn from the mistakes that we've done, especially when we're so used to the name, blame, and shame culture that we do not want to acknowledge these little errors or little mistakes in our implementation strategies, the failures that we have experienced. So we need everyone, we need us to be transparent, we need us to be honest and reflective in our practice, and we need to kind of allow our senior managers to model this mindset. So for this session, I do want to stress on these 2 points. So the overemphasis on top-down approaches and the failure to adapt. So top-down approaches focuses on strategic planning and decision making. So we have directives coming from the senior management, financial incentives, and resource allocation. So these different components, the organizational leadership and resource management are key for successful implementation. We know that. However, empirical evidence from reviews is also clear that these factors are often not enough on their own to achieve lasting practice change. So striking a balance between top-down and bottom-up approaches is important for successful implementation and to sustain these interventions. We need to integrate our approaches. This means combining strategic directives from our senior management coupled with insights gained from the community engagement. So we need to encourage our leaders to work alongside community representatives. Failure to adapt. So I'm going to draw on the example of telemedicine here. So despite the potential of telehealth services to increase the quality and accessibility of healthcare services, the implementation success rate of such services is low. The program designers, found in the systematic review did not fully account for the local context, particularly the infrastructure, the local context in terms of whether or not there is high-speed internet, whether or not there is a certain level of digital literacy among the users. So in the targeted rural areas that some of these researchers were looking at, many households lack reliable internet access and residents have limited experience with digital technology. What it means for us is this critical need to adapt implementation strategies to the specific socioeconomic and also the educational conditions of the targeted population, to take into account the local context, to look at what is available there in the local context that allows this to take place. So, why do we need tools to measure sustainability? We certainly need tools to measure sustainability. The first one is we want to look at continuation beyond initial implementation. We want to identify potential challenges and barriers and taking proactive measures to address these, to ensure that these interventions remain integrated within the system. Adaptation to changing contexts. Over time, the context in which these interventions are implemented can change because of so many factors, such as shifts in policy. One day you have this policy, and the next day you have these policy changes, economic conditions, or even population needs. So having these tools allow continuous monitoring of how well interventions can adapt to these changes. And finally, evidence-based decision-making to justify continued funding, to support scale-up of successful interventions, and to inform the development of new policies and practices. Now, what components of sustainability would we be interested in? The 5 components that make up sustainability, the first one will be sustaining the what's, right? The 7 P's. Is it the program? Is it the practice? Is it the procedure, the policy, the product, the pills, or even the principles that we want to sustain? Sustaining the hows or change strategies. it's essential to evaluate whether people are still continuing to use these change strategies over time, and whether people have made some adaptations to them. And finally, outcomes measurement. By doing this, we can ensure that we're still achieving the intended results, and what we are implementing still meets people's needs. And application of sustainability measures, I would like to share with you this systematic review on sustainability measures that aims to evaluate the quality and empirical application of measures on sustainability and also sustainability determinants, which are the factors that are related to sustaining programs for use in clinical, public health, and community settings. So what it does, it reveals that the majority of research is centered on sustainability determinants rather than outcomes. Of the 28 individual measures identified, 25 focus on sustainability determinants and only 2 assess sustainability as an outcome. So this imbalance tells us that the field has a stronger emphasis on identifying and understanding factors that impact sustainability rather than measuring the actual long-term success and also the benefits of interventions in terms of the outcomes. So this list of checklists, which is available for you to use, is useful in a way that you're able to see which constructs each tool is assessing, whether it's measuring the outer context, the inner context, the policy environments, the external partnerships, or even the inner context, which reflect organizational culture in terms of the beliefs and values, leadership and support, the intervention characteristics, and also the intervention characteristics. So one particular scale that seems to be useful for me is the Sustainment Measurement System scale, which has been used previously for mental and behavioral health. So this 35-item scale comprised of 8 domains, has good reliability and ability in assessing the likelihood of sustaining prevention programs. And it can help identify predictors of program sustainment, and it serves as a tool to improve the chances of success through ongoing evaluation and feedback. So the domains that are included are sustainment indicators, funding and financial support, responsiveness to community needs, responsiveness to community values, coalition, partnerships, and networks. We're examining whether or not we are still, passionate, whether these partnerships, members of this partnership are still passionate in committing to sustaining the project. And also looking at the infrastructure and capacity to support sustainment, implementation, leadership, and finally evaluation, feedback, and evidence of positive outcomes. And I think it's really nice in a way that it's very comprehensive. It includes all the necessary things that we want to see, the community engagement that we build, the implementation strategy itself, and then looking at whether this infrastructure is well maintained to support this intervention. So, in conclusion, sustainable implementation in clinical and community settings relies on effective stakeholder engagement and capacity building, which empowers stakeholders and integrate interventions into existing systems. Continuous monitoring and evaluation, along with identifying clear metrics, are essential for adapting interventions to changing needs and ensuring their long-term success. Utilizing standardized sustainability assessment tools, it's supporting data-driven decision-making and the continuous improvement of interventions, and ultimately emphasizing sustainability within implementation science maximizes long-term health outcomes and also resource utilization. Before I end, I'd like to make a quick important note. So when thinking about implementation science, one of the things that I noticed that we sometimes tend to overthink about the sustainability, and what it does, it hinders our creativity. I know that a lot of people, including myself, would always overthink sustainability in a way that it's not allowing me to be innovative. We become really scared to think about whether that would fit in, whether that would have long-term impact. But think about the sustainability outcomes that we discussed a while ago. So there are many different sustainability outcomes. So your engagement with people, the intention, the motivation to have this implementation in the first place, So I think please do continue to be bold in thinking about creative ways in thinking of your optimization strategy. With that, I end my presentation. Thank you.